All right. Well, welcome everyone to our Sleep Divas Live, which is all about melatonin today. So I'm excited for this conversation because melatonin is one of these things that's kind of commonly asked about. People don't really understand what it is. Is it a hormone? Is it a supplement? What should you do with it? When should you take it? Does it actually work? So we're going to be answering all of these questions and more today on this discussion about melatonin, good, bad, or ugly. So, Amanda, would you like to lead us in and tell us a little bit about what melatonin really is?
Yeah, thanks, Nishi, and welcome, Divas. I'm Amanda Slinger, and I'm a sleep coach and sleep practitioner based in Perth in Western Australia. And yeah, melatonin, it's such a topical subject. I'm particularly hearing a lot about melatonin in Australia because it's just recently become available as an over-the-counter medication. So a lot of people are now supplementing with melatonin. So I'm frequently getting lots of questions about, is it good? Is it bad? And does it have an ugly side? So hence our topic today, melatonin, good, bad, or ugly. So look, melatonin is produced naturally. It's a hormone that's produced naturally by our pineal gland in our brain. And it's produced in response to darkness. So melatonin regulates the circadian rhythm and it tells our body that it's time to sleep. So I think one of the misconceptions that I find with people is that they think that melatonin helps them to fall asleep. And my readings and understanding is that it doesn't. It helps with the timing of sleep, and we can get into that a little bit later. So once the sun sets, our melatonin levels start to rise, and they peak, and I've heard different things, 12 o'clock, 2 o'clock, and I really think it depends upon your, whether you're a night owl or, a morning lark, but it depends, whether you like to stay up late and you're what's the word I'm looking for here? Your help me out.
Nishi, your circadian rhythm?
No, I'll come back to it. Whether you're a night owl or a morning lark, what's that called?
Your chronotype.
Yes. Lucky winner. All right, I'm just going to let somebody into the room who's waiting. There we go. So look, it's produced naturally. I think the important point is that it's a natural hormone produced within our body, and that's called endogenous. And exogenous melatonin is something which is produced from outside our body. Well, it's come from outside our body, and we've taken it as a supplement. So when we talk about supplementing melatonin, and we're going to go into dosages and what time and whether it's short acting or long acting, but I think some of the misconceptions that we really need to unpack around melatonin is it's not, if we take it as a supplement, it's not natural. So we want to try and optimize things that can enhance our natural secretion of melatonin. And I think with that, I just got someone who's walked in the door. Nishi, or Smita, can you take over from there? Sorry.
Yeah, no. So we're just really kind of, going to talk a little bit more about melatonin. Everyone uses it. I know adults use it. I know children get it. And is it good? Is it safe? Is it recommended? And let's start with dose. What's a dose you would recommend for anybody, like even children, if you see them or if you don't. But so what I have read from the studies is that the lower, the better, right? So especially in melatonin, in this case, physiologic levels are lower. So like 0.1, 0.5, we don't need the 5 milligrams, like we need the 0.1, 0.3, something like that. And so, to mimic more physiologic levels, when we do higher than that, what is that doing to our hormones? What is that doing in terms of risk? And so, Nishi, do you have any comments on that?
Yeah, I think that's a great point. And and I think, we can just do another quick introduction since looks like we've had some new people join. So I'm Dr. Nishi Bhopal. I'm a psychiatrist and sleep doctor based in the San Francisco Bay Area. And then we have Dr. Smita Patel, who's a sleep physician and neurologist from Chicago, and then Amanda, sleep coach from Australia. So, okay, dosing. Now, what I find is that people usually take way too much melatonin, as you were saying, Dr. Smita, because melatonin is a hormone, right? So like if you're going to take a hormone, like for example, if you're taking estrogen, you're not going to take like 100 times more than your body would normally produce, right? Or even 10 times more than your body would normally produce. But if you're taking melatonin in doses of 3, 5, 10, or 20 milligrams, which is what you frequently see in the pharmacy, that's, multiple fold times more than what your body's actually making. And so melatonin is secreted in the pineal gland in the brain. So when I dose melatonin, either for myself or if I'm recommending it to patients, I usually use doses that you mentioned, like 0.3 milligrams, which is 300 micrograms, or maybe 0.5 milligrams, which is 500 micrograms. And those doses can be hard to find in stores. So you may need to get them online. And in our last discussion, we talked about how to find a good quality supplement and some of the criteria. So if anyone's interested in that, you can check out our last live discussion on how to choose a good quality supplement.
Yeah, the same
because there's so much variability.
We want to make sure, right, that you get this the right whatever brand you pick. Want to make sure you're getting the dose that you're supposed to get, and that it says on the bottle. And so, by looking at verified company brands, you would want that. So you can go back to our previous one to look more at that. But what do you think about kids getting these? Getting melatonin, first of all, and then gummies on top of that, because they have the gummy formulations.
Yeah, I'm not so keen on even talking about kids in this session today. We've got half an hour, and kids, it scares me when people start to take gummies because it's so much like a lolly. And I think there's a really important place for melatonin with delayed sleep phase disorder for teenagers. And in addition to bright light therapy, it can be a really important treatment regime. But yeah, it is a bit frightening. I think that the gummy, who doesn't love a gummy? So kids are treating it a little bit like lollies. So I think what I just wanted to say about the dosing is that I see people mega dosing, and this is really scary. And I think, we've got to be very, very careful about dosing. And I think that's one of the really key messages that we need to give people today is, and it's the same when we were talking with our last live around supplements on, less is best. Just try at a very low dose. And there's no scientific evidence that anything more than 3 milligrams has any effectiveness on your sleep. And I wanted to come back to the point, now that things have settled down in my house, dogs and people arriving, is just, there was a meta-analysis, which you're probably both familiar with. And it just goes to the point, well, it talks about melatonin. Often people think that melatonin will help you fall asleep, but in fact, it only increases your time to fall asleep by, I think it was 3.9 minutes, which is, it's a little bit, but it's not really that significant. And in terms of improving sleep efficiency or sleep quality, it's only about 2 or just a little bit over 2%. So, when we look at why do we want to be taking melatonin, I think that's a really important thing. If it's to fall asleep more easily or faster, I don't think that really has a place. But we need to go back to the purpose of the hormone within our body and what is it affecting, and it's affecting the timing of sleep. So if you've got delayed sleep-wake phase disorder, or you're wanting to get over jet lag or prevent jet lag, or minimize the effects of jet lag, I think it really has a good role there. And I think melatonin also, you guys will probably know more about this being medical doctors, is its other beneficial effects on our body, on our gut. It's also a very powerful antioxidant. There are many, many other supposed effects of melatonin. So, I think the dosing, I think perhaps we could talk a little bit more about, because I think back to, what do people really want to know? They know what melatonin is, but how do I take it? What are some of the side effects that I need to watch out for? How long can I take it for? And there's short acting and long acting melatonin. So what do you both prescribe or recommend when you're talking with your clients about melatonin in terms of, is it short acting, and what would you use short acting for versus long acting?
She can go
Yeah.
first. Or...
Sure. Yeah. So I always go back to that question that you just asked, Amanda, which is, well, what are we using it for? And so the first thing I tell people is that melatonin is not a sleep aid per se. It's more of a body clock regulator.
Yeah.
So we use it to help kind of modulate the circadian rhythm or the body clock and regulate the timing of sleep. And like me personally, I'm a little bit more of a night person. Like I can easily shift into more of a delayed sleep schedule. So I use melatonin to pull my sleep schedule earlier. So that's what I use it for with my patients as well. And so when we look at timing, usually anywhere from like an hour before bed, sometimes 2 to 3 hours before bed, depending on what their circadian rhythm is like. So this is a key point for people to know, is that if you take melatonin at the wrong time, it can throw your circadian rhythm out of whack. So you have to kind of know what you're doing a little bit. But for most people, about an hour or two before bed is usually appropriate. It also can be helpful for advanced sleep phase syndrome. So this we commonly see, more in older adults. And this is a condition where people fall asleep too early and then they wake up too early. So they're falling asleep at like 8 p.m. or 7 p.m. and they're waking up at 3 or 4 in the morning and they can't sleep past that. So sometimes a little bit of melatonin at that time, like at 3 or 4 o'clock, can actually push their sleep a little bit later, where we want them to fall asleep later and wake up later. So that's the first thing is to figure out, okay, well, what are we actually treating? And that's going to help us determine the timing of it. There's also uses in jet lag. And again, sort of similar principles apply here, whether you're going west or you're going east, you might take it earlier in the day or later in the day. So melatonin is really interesting that way. And as you mentioned too, I just wanted to highlight that there are other effects that it has. There's melatonin receptors all over the body. Melatonin, it is a hormone. It does have anti-inflammatory effects. They're studying it for anti-cancer effects. It's being studied for COVID as well. It's like a mystery hormone. It's got so many effects on the body that we don't quite understand. But one thing I want to point out to people as well along these lines is that melatonin is a hormone. It can sometimes suppress insulin levels. So if you're taking too much of it, it can actually shoot your blood sugar up. So that's another consideration for people who struggle with blood sugar regulation, and another consideration for dosing. So remember that just because you might be taking it for sleep, it can have a whole host of downstream effects as well.
Yeah. And just while we're on the just while we're down on the, I guess, the ugly sides of melatonin, it's also, it causes drowsiness, obviously. So if you're taking any other medications that might increase drowsiness, you just need to be aware of, that cumulative effect. Sorry, Smita?
No, it's great. It was just a conversation, right? So I also wanted to kind of bring up that, I know some people take melatonin for a long time. Is there a timing as to I haven't found it in the literature per se, but I don't keep them on melatonin. I don't have a set duration like 2 years or 1 year or 2 weeks, something. But I know that long-term use might even contribute to fractures. So do you guys have a duration of time that you keep melatonin on, that you keep your patients on?
Yeah, for me, it's, 2 to 3 weeks. It's for a short, it's to get over a hump is how I describe it. Anything and always to consult your doctor, but I wouldn't be recommending people to really rely on melatonin for longer than 2 or 3 weeks. And if they are, I think there's something else that they need to be unpacking about their their sleep-wake cycle. So what else is affecting, what else could they do to improve their sleep? I think, also people using melatonin, I don't think people are using it well. If you look at all the things that we've already discussed, are people taking it too early, too late? And if you're taking long-acting melatonin and you're wanting it to help to bring the onset of sleep forward, but you're taking long-acting, that's not really going to have a big effect. So I think, unpacking, is it short acting? Is it long acting? Back to the original question, what am I taking it for? I think there's so many things that people are doing wrong around melatonin than doing right. And so if people are taking it for a long time, I think we just need to look at, well, what is the dosage? When are you taking it? Timing and all those sorts of things.
And I also, agree with just using it for a time limited duration, because most studies don't look at melatonin beyond, like maybe 3 months. So we don't really know what the long-term ramifications are of taking it, for extended periods of time. So in my practice, I usually don't go beyond a few weeks. And again, it depends what we're using it for. So I have a protocol that I use for people if we're shifting their circadian rhythm. We might use it for 6 or 8 weeks and then stop. For others, we might use it just for 1 or 2 weeks. So again, it depends on the indication, on the reason. And then I also wanted to point out the side effects. So Amanda, you alluded to some of these. And so as a psychiatrist, I see people who experience depression from long-term use of melatonin. They don't realize it's from that. But it turns out like, oh, well, yeah, I've been taking melatonin for 3 years. They didn't think it was relevant to bring that up, but that can have a significant effect on mood or irritability, or even just kind of chronic fatigue, daytime grogginess, drowsiness in the morning. All of these things can happen with even lower doses of melatonin. So I encourage anyone who's taking melatonin on a regular basis to just do a self check-in to see if you're experiencing any of those symptoms, because they could be side effects of melatonin supplements.
Nishi, that's really interesting. So with long-term use of melatonin, you're saying that it can increase the frequency or prevalence of depression. Is that related in some way that it's suppressing our body's natural production of melatonin, which, of course, serotonin is the precursor to melatonin, which is produced in the gut. We need to have a healthy gut to get our good melatonin levels. But is it possibly because of the reduced need inside our bodies to produce melatonin, the reduced need for serotonin to be produced, and serotonin is so important for our emotional well-being? Is there a link there?
It's a really good question. And I think it's one of those things we don't fully understand yet. And there is this kind of idea that, okay, if you take melatonin long-term, does it actually suppress your own endogenous production of it? And I'm not sure, if there is an answer on that. I'd be curious to hear what Smita has to say, if she knows of any data supporting that. But my understanding is that it's kind of one of these unknowns still. But yeah, you do need a healthy gut. So, even though melatonin is produced in the brain, there is some that's produced in the gut as well. 90% of our serotonin is produced in the gut. So this always, we always go back to like good lifestyle habits. So good sleep hygiene, and then like eating well and taking care of your body, because all of these things are going to help support good quality sleep.
Yeah, so I don't think we really measure on a routine melatonin levels or serotonin levels. So that hasn't like really been common practice in the medical world. So in research studies, perhaps they do it, but I haven't seen a whole lot of studies on it either. And the concept is, if you have too much melatonin, what does it do upstream, right, to the tryptophan and the serotonin? And I don't actually have a good answer for that either. But yes, the question still remains, like, if you take too much, what happens? Do you shut down your own production? Yeah. Are you able to then make your own production if you've taken it for too long? Those are all good questions that I don't have answers for at this moment. But, do you guys notice any difference in the different formulations? There's liquids, lozenges, capsules, the gummies, which my take on the gummies is that it has too much sugar. And then kids are really taking these gummies and then they're going to sleep. Are they brushing their teeth? What are we doing about tooth decay? So those kind of questions come up for that. But in general, otherwise, do you guys have if you noticed different forms? I'm just going to add before I let you guys answer, but I kind of am biased a little bit more towards the liquids, only if we really want to do low doses. The liquid maybe allows you to easily, cut the dose because, these capsules are so small and then you're just making powder out of it. So, but other than that, do you guys find that any formulation works better, or?
I don't find that there's any difference between gummies, capsules, liquid. The only difference is whether it's short acting or long acting. And of course, how much we can rely on the actual level of melatonin in that bottle of tablets that we've bought or the capsules that we've bought. I like to think that compounding pharmacies are a really good source of good quality melatonin. But I don't really see a difference between the form that it comes in.
Yeah, I agree with that. I'm sort of biased towards the capsules because I feel like it's just easier to control the dose. Versus sometimes with liquids, like sometimes it's like, oh, I put too many drops in or whatever. So, but liquids are also really helpful for people who struggle with absorption, vitamin, different forms of supplements, and also for people who are weaning off, you can titrate the dose a little bit more carefully using a liquid. So, what I tell my patients is
cutting down the dose easier, right?
Exactly.
Otherwise it's messy, right?
Yeah. And I just tell people, like, use what works for you. So, if you prefer the liquid, take that. If you prefer the capsule, take that. But again, it comes back to quality too, because of that recent study that came out showing that with melatonin supplements, what's actually in the bottle can range from like minus 87% less or 450 something percent more than what's on the label. And there's some supplements that say they have melatonin in them and they actually don't, and they actually have serotonin in them or valerian or all these other things. So you want to make sure that what you're taking is of good quality so you can actually trust what it says on the label.
I think what would be really helpful if we put together a little checklist of, if you are considering taking melatonin, these are the things that you should be considering, like all the things that we've just discussed. And something which we always talk about is, women waking up in the middle of the night and not being able to fall back to sleep. Now, I do think that there's a place for long-acting melatonin potentially with people who have this problem. But if you've got short-acting melatonin, that's not going to really affect or make a big difference whether or not you stay asleep during the night.
Yeah, I do find that the long-acting forms can help more with people who struggle with sleep maintenance or waking up in the middle of the night, whereas the short-acting is more for adjusting the body clock, or if you need a little bit of support with, just your circadian rhythm. So again, it depends. And another thing too is that certain medications can deplete the body's production of melatonin. So there actually may be some cases where longer-term use could be appropriate. For example, beta blockers can deplete the body's production of melatonin. So people who are taking those medications may find that they struggle with sleep, and taking melatonin may actually help them. And then with age, the pineal gland just doesn't work as well. I mean, Smita's a neurologist, so she can probably share more about that and how melatonin levels decline with age too. So there may be some utility for longer term use of melatonin supplementation in older adults.
Yeah, the geriatric population, gets a little tricky because also if they're having some cognitive issues, things like this, the melatonin might cause some side effects. And so again, this is very tricky. We just have to individualize it. How do you react with it? And starting low and slow and not forever is, again, this is still the same concept, right? That we've been kind of talking about with melatonin. I was going to say, so the long-term the long-acting might also contribute to some more daytime drowsiness. And so that's another thing that we just kind of have to individualize. Are you able to clear it out fast enough for your body? Or, do you need to take it a little bit earlier? I also found that melatonin is both fat and water soluble. So you don't need to have food with it. So you can take it, with or without food. It doesn't matter when you take it near bedtime or before. So
that's a great tip. Yeah. And we can also, I know we just have a few minutes left. So I think we can also touch on light and how light affects melatonin. I think that's an important one. And Amanda, sorry, you were about to mention something as well.
No, that's okay. Go ahead.
Yeah. So the brain produces melatonin in an environment of darkness. So it's, that sun setting and that exposure to darkness that helps promote our natural rhythm to produce melatonin in the evening. So another thing for people to remember is that if you're getting a lot of light exposure at night, that can potentially reduce your own production of melatonin. And if you're taking supplements, it might not be as effective. as well. So, we always emphasize not to just rely on these external things to help you sleep, but you want to make sure that all the other practices and behaviors that you're engaging in are going to support you with good sleep and help make whatever you're taking supplement wise or otherwise more effective.
Yeah, really good point. So that, even the timing of your exposure to light in the morning, I think that really makes a big difference in going back to, well, what does influence my sleep? And it's your sleep hunger, adenosine levels and them increasing during the day, but also it's your circadian rhythm and the timing of that. So we know that sunlight is a really important trigger for the timing of our circadian rhythm. So getting up and getting exposed to natural light, so not light through a window, but outside and getting good exposure to light. Gosh, we could talk about this forever.
I know we have coming up on time, but I know a lot of people sleep with their night lights on. So, sometimes that doesn't get brought up always in the conversation early on during an intake. But if they have the night light on and they took melatonin, do you think that that's helpful for that patient?
It's interesting. My teenage son has got these lights in his room, some fancy lights that go on the wall and different colors. And I make him dim them as much as I can make him. But once he's asleep, I go in there and I turn them off because it's just light. It's going to, upset his melatonin secretion.
Yeah. So we have to kind of make sure that, if you are using melatonin, we really want you to sleep in the darkness. We have to kind of employ those night blind, what are those darkening shades, and so that you can kind of have that darkness in your room, and then keeping the nightlight, if you need a nightlight, keeping it kind of like maybe in another room, but not in the space that you're sleeping, just so if you had to get up at night, go to the bathroom, at least you have a little bit of guidance with that, so you don't trip and fall. But yeah, so it's another kind of thing that that does come up, the night lights in the bedroom. And then that's kind of shutting off there. Even if you're not taking a melatonin supplement, maybe even it's kind of shutting off your melatonin drive.
Absolutely. So, we're coming up on the top of the hour here, so we'll wrap up in a moment. Any last parting words of wisdom from the Sleep Divas?
I think just for me, just a reminder that, melatonin is one of the most popular sleep supplements available at the moment, but it's important to use it with caution. So if we go back to, melatonin, the good, the bad, or the ugly, I think there is the good. I don't know if there's such the bad, there's a little bit of ugly, but it just needs to be used with caution. And we will put together a PDF with a checklist on what you should be looking out for when you're considering taking melatonin as a exogenous supplement.
Great. And Smita, any last final thoughts?
Yeah, no, I agree. Again, it needs to be used with caution in the right patient, low dose, go slow, low and slow if you need it. I think that's kind of another important point.
Absolutely. So less is more when it comes to melatonin. Watch your light exposure. Think about why you're using it. Don't use it for too long. I think those are the general takeaways from today. Oh, and good quality supplements. Yeah. So thank you for joining us today. And if you are watching this on YouTube, go ahead and click the like button and subscribe so that way we can get this information out to more people. And then stay tuned for our announcement about our next Sleep Divas Live. Thanks and have a good night.
Night.